Hello, this is Dr. David Green, CEO of the U.S. Pain Network. The topic today is the top 10 reasons prescription pain creams are great for pain relief. For the millions of Americans who suffer from chronic pain, prescription pain creams can offer relief for a ton of different conditions. They're safe, they're effective, and they're FDA-approved ingredients. So the conditions that benefit, there's a lot of them. Back and neck pain, RSD, also known as CRPS, elbow or Achilles tendonitis, such as golfer's elbow, tennis elbow, neuropathy, whether it's diabetic or peripheral, sprains and strains, degenerative or rheumatoid arthritis all over the body, plantar fasciitis, which can be extremely painful, phantom limb pain, after you have an amputation, it can be extremely painful, post-surgery pain, sciatica, muscle spasms, shingles, TMJ, trigeminal neuralgia, and all kinds of sports injuries. So the top 10 reasons they are great. Number one is they provide direct pain relief. So for instance, for diabetic neuropathy, the cream is applied directly over the hands or the feet, wherever the pain is, and it gets slightly absorbed underneath the skin for direct pain relief. A recent survey by Patient Outcomes Analysis showed that 38% of people were able to reduce the amount of pain medications they take by mouth for these types of conditions, which is great. Do you really want your organs to be effective, or chances for addiction or other side effects? This way it just goes directly where it's needed. Second reason is that there's minimal bloodstream absorption of the pain creams. I say minimal, usually there's none, right? So the prescription pain cream stays where it's applied, it just goes a little bit underneath the skin. It really doesn't reach the bloodstream in any appreciable amounts, and therefore there's no systemic effects throughout the body, and that could potentially cause some complications. The third is that they do reduce inflammation and swelling significantly. It works very well for acute injuries and also for flare-ups of chronic conditions such as degenerative arthritis. Therefore, it can help with getting people to sleep better, concentrate better, functional abilities with recreational activities, or doing what you need to do to get through the day. 83% in that same survey from the Patient Outcomes Analysis showed that the pain creams are really, really effective for pain relief with the reduction of inflammation and swelling. The fourth is that there are really no side effects. They do have excellent pain relief. They don't have any controlled substances. Therefore, there's no constipation, tolerance, addiction, none of those things that come from systemic medications. Number five is that there's no organ toxicity. Because they don't reach the bloodstream, there's no effect on the organs. They don't cause issues with the liver, because a lot of pain medications, when you take them by mouth, they end up getting metabolized through the liver, sometimes the kidneys, and those can cause issues, especially if you have a baseline issue to begin with. So if you have a baseline issue to begin with, these are great. There's no alterations in your hormones either. When you take chronic pain medication, you can end up with some testosterone deficiencies and other abnormalities that need to be fixed. You don't have that with these direct pain creams. The sixth is that they're non-addictive. Opiate addiction is now an epidemic. Why not obtain pain relief with creams that are not addictive? You don't get tolerance issues, so you don't have to use more and more and more based on the bloodstream, and you also don't have the addiction where you have to take more and more and more to get the same effect. Number seven is that they're non-sedating. So for those people who are business and they need to work, then you don't want to be falling asleep at the desk or in your car from the sedating effect of other controlled substances like opiates or anything that you might be taking. The other problem that you can have with opiate medications is the opposite effect. You can get insomnia. See that all the time. So what you could get with this is really no effect. You don't have a sedating effect, you don't have insomnia. Number eight is that they're odor-free. A lot of the ones that you get over the counter are not odor-free, such as the Bengays of the world. But the ones from Prescriptions Plus, the compounded pharmacy, have no odor at all. Number nine is there's no drug interaction risk. In this day and age, the problem of polypharmacy is exacerbated by the fact that multiple conditions are often being treated by multiple different doctors. And they don't often communicate. So you're already at enough risk for a drug interaction problem, but because these aren't absorbed, you don't have that issue. And the 10th reason is that it leaves your decision-making capacity intact. If you're in a position where you're making decisions that might affect you personally or professionally, it's much better to not have to take medications by mouth so that you can make those decisions. Also, it can help you concentrate better by relieving your pain. Prescriptions Plus has been in business for 25 years. They offer free shipping with all their prescriptions. They're licensed in all states. They will do all the legwork. If you call them, they'll help you with the prescription, getting your doctor to sign it, and then they'll take over as far as getting you shipping to your doorstep. They have licensed pharmacists and personal patient advocates to answer all of your questions. Please visit us on the web at prescriptionpainreliefcream.com or just call us directly at 888-998-6343. I'm Dr. David Green with the U.S. Pain Network. Your pain stops here.